Chest tightness is a frightening sensation that demands immediate, precise action, but the very first thing you must do is physically stop whatever you are doing to lower the demand on your heart. When the chest tightens, squeezes, or feels heavy, it is a signal that the heart muscle may not be getting enough oxygen. Your immediate priority is not to figure out what is wrong, but to conserve every ounce of energy you have. We are going to go through 8 critical life-saving steps you need to take in the first few minutes of this sensation. These steps are designed to buy you time, prevent further damage, and prepare you for professional help. 1. Stop moving and sit down immediately. The moment you feel that pressure, tightness, or unusual discomfort in the center of your chest, you must stop moving instantly. If you are walking, stop. If you are carrying groceries, drop them. If you are climbing stairs, sit on the nearest step. Every single physical movement you make requires your muscles to use oxygen. When you move your legs or arms, your heart has to pump harder to send blood to those working muscles. If your heart is already struggling, forcing it to pump harder is dangerous. By stopping immediately, you reduce the workload on the heart. You are essentially putting your body into idle mode. This allows the limited oxygen available in your bloodstream to be directed to the heart muscle and the brain, rather than being wasted on leg muscles or arm movements. This single action can prevent a mild episode from escalating into a severe cardiac event. The best position to take is a seated position, ideally on the floor with your back leaning against a wall or in a sturdy chair with a backrest. This is often called the W position if you are on the floor with your knees bent and feet flat. Sitting is safer than lying flat on your back. If there is fluid building up in the lungs, which can happen during heart distress, lying flat can make it harder to breathe. Lying flat also increases the volume of blood returning to the heart, which can overwhelm a weakened pump. Sitting up keeps the diaphragm free and makes breathing easier. Furthermore, sitting on the floor is safer than standing because of the risk of fainting. If the heart rhythm becomes unstable, you might lose consciousness. If you are standing, a fall can cause severe head trauma or broken hips. If you are already sitting on the floor or in a secure chair, you are safe from a fall. This is a physical safety lock. It secures your body against gravity and gravity-related injury. It is the absolute first step before you even reach for a phone or a pill. Most older adults can lower themselves to a safe seated position or find a chair within seconds. Here is the second non-negotiable step. 2. Call emergency services immediately. Once you are seated and safe from falling, your next action must be to call 911 or your local emergency number. You must do this immediately. Do not call your son, your daughter, or your neighbor first. Call the professionals who have the equipment to save your life. There is a concept in emergency medicine called the golden hour. The faster you get medical attention, the more heart muscle can be saved. Many seniors hesitate to call. They worry about being embarrassed if it turns out to be just indigestion or anxiety. They worry about bothering the paramedics. You must let go of this mindset completely. It is infinitely better to be embarrassed in the emergency room than to stay at home with a life-threatening blockage. Paramedics would much rather come to your house for a false alarm than arrive too late. Do not try to drive yourself to the hospital. This is one of the most dangerous things you can do. If you lose consciousness behind the wheel, you endanger your own life and the lives of others on the road. Do not wait for a relative to come pick you up either. That travel time, your relative coming to you, then driving you to the hospital, is time you do not have. When you call, speak clearly. Say, "I am having chest pain." This phrase triggers a specific high-priority response from the dispatch center. It ensures that the ambulance sent to you is equipped with advanced cardiac life support tools, such as an ECG machine and defibrillator. Emergency medical technicians, EMTs, can start treatment the moment they walk through your door. They can administer oxygen and medication right in your living room. If you drive yourself, treatment only starts when you get through the hospital doors and past the waiting room. The ambulance brings the hospital to you. This is the smartest decision you can make. It guarantees you are in professional hands as fast as possible. Here is the chemical intervention you can do while waiting. 3. Chew a full-strength aspirin. After you have called for help, and while you are sitting waiting for the ambulance, the third step is to chew a specific type of medication, aspirin. If you are not allergic to aspirin and your doctor has not strictly forbidden it due to bleeding risks, this is a proven lifesaver. A heart attack typically happens when a plaque in an artery ruptures and a blood clot forms around it, blocking the flow of blood. This clot is made of platelets, tiny blood cells that stick together. Aspirin works by making these platelets slippery. It prevents them from sticking together and making the clot bigger. It essentially stops the blockage from growing. The key instruction here is to chew the aspirin. Do not just swallow it whole with water. When you swallow a pill, it has to go down into your stomach, dissolve, pass into the small intestine, and then be absorbed. This process can take 20 to 30 minutes. You do not have 30 minutes. By chewing the aspirin, you break it down into a paste. This allows some of the medication to be absorbed directly through the lining of your mouth, the buccal mucosa, and throat, entering your bloodstream in as little as 5 minutes. It bypasses the slow digestive process. The recommended dose is usually 1 full-strength adult aspirin, 325 milligrams. If you only have baby aspirin, 81 milligrams, you should chew 4 of them to equal 1 full dose. Chew it thoroughly until it is a paste, and then swallow. The taste may be bitter, but that bitterness is the taste of a potent medicine working fast. This action acts as a chemical brake on the clot. It buys you time until the doctors can physically remove the blockage. It is a simple action that fits into the first 5 minutes of the event. Most older adults have aspirin in the cabinet. Keep it somewhere easy to reach. Here is a physical adjustment to help you breathe. 4. Loosen tight clothing. The fourth step helps you breathe and reduces panic. Loosen any tight clothing around your neck, chest, and waist. When you are in distress, your body initiates a fight-or-flight response. You need to take in more oxygen. Tight clothing can physically restrict your chest expansion and make you feel like you are suffocating. If you are wearing a necktie, undo it completely or take it off. Unbutton the top button of your shirt. If you are wearing a scarf or a heavy coat, remove them. If you are wearing a belt, unbuckle it. For women, a tight bra can feel incredibly constrictive during chest pain. If possible, loosen it or unhook it to allow the rib cage to expand fully. This step is not just about physical mechanics, it is about sending a signal of relief to your brain. The sensation of constriction around the throat or chest increases anxiety. Anxiety raises your heart rate and blood pressure, which is exactly what we want to avoid. By removing these restrictions, you feel freer. You can take deeper, easier breaths. Improved airflow means more oxygen enters the lungs with less effort. This oxygen is then available for the struggling heart. It also helps with temperature regulation. People experiencing heart issues often break out in a cold sweat or feel suddenly overheated. Removing layers or loosening collars helps your body cool down naturally. This is a quick, practical adjustment. It takes only a few seconds but provides immediate comfort. It helps the body function more easily by removing external resistance. Here is a step only for those with a specific prescription. 5. Use nitroglycerin if prescribed. The fifth item applies specifically to seniors who have been diagnosed with angina or heart conditions and have been prescribed nitroglycerin by their doctor. If you have this medication, now is the time to use it, but you must follow the safety rules strictly. Nitroglycerin is a powerful vasodilator. This means it instantly widens the blood vessels. By widening the veins and arteries, it lowers blood pressure and reduces the amount of work the heart has to do. It also opens up the coronary arteries, potentially allowing more blood to flow past a partial blockage. However, you must never take nitroglycerin while standing up, because it drops blood pressure so quickly. Taking it while standing can cause you to faint instantly. You must be sitting down or in your safe W position on the floor before you take it. Place the tablet under your tongue and let it dissolve. Do not swallow it. Like the chewed aspirin, it needs to absorb through the mouth tissues to work fast. If you have the spray version, spray it under your tongue as directed. Usually, the instruction is to take 1 dose and wait 5 minutes. If the pain continues, you may be instructed to take a second dose. Always follow the specific plan your cardiologist gave you. If you do not have this medication prescribed to you, do not take someone else's. It can be dangerous if your blood pressure is already too low. This medication acts as a liquid rescue for the heart vessels. It is a targeted tool for those with known conditions. It is easy to use if you are prepared and seated. Here is a logistical step that saves critical minutes. 6. Unlock the front door. The 6th step is a practical, logistical action that many people forget in the heat of the moment. Unlock your front door. If you are alone in the house, this is vital. After you have called 911 and before you settle back down into your safe sitting position, go to the door and unlock it. Open it slightly if you can, or just ensure the deadbolt is disengaged. If the paramedics arrive and the door is locked, they have to waste precious minutes finding a way in. They may have to break the door down or wait for police backup to force entry. Those are minutes where they could be treating you. Breaking a door is also loud and chaotic, which adds to your stress levels. By unlocking the door, you ensure that help can walk right in to get you. If you are unable to walk to the door because the pain is too severe or you feel faint, do not force yourself. In that case, the dispatcher on the phone will tell the paramedics to break in. But if you are still mobile in the first minute or two, unlocking the door is a smart, proactive move. Once the door is unlocked, return immediately to your chair or your spot on the floor. Do not wait by the door standing up. Return to safety. This action is about access. It clears the path for the rescue team. It is a simple preparation that shows clear thinking. It helps the paramedics help you faster. Here is a mental technique to control your body's reaction. 7. Use 4-7-8. Calm breathing. The 7th step involves controlling your nervous system through breathing. Panic is the enemy of the heart. When you panic, your body releases a flood of adrenaline and cortisol. These stress hormones make your heart beat faster and squeeze harder. This increases the demand for oxygen at the exact moment when you need to conserve it. You can manually override this panic response using a technique called 4-7-8 breathing. It is simple and effective. 1. Inhale quietly through your nose for a count of 4. 2. Hold your breath for a count of 7. 3. Exhale completely through your mouth, making a whooshing sound for a count of 8. The long exhale is the key. When you exhale slowly, you stimulate the vagus nerve. The vagus nerve acts as a brake on your heart rate. It tells the brain that you are safe and that it can lower the alarm state. Do this cycle 3 or 4 times. You will feel your shoulders drop and your racing mind slow down. It gives you a point of focus. Instead of thinking, "I am scared," you are thinking about the counting. This distraction is powerful. It keeps you present and calm. Even if you cannot do the exact 4-7-8 count, simply focusing on making your exhale longer than your inhale will help. Slow, rhythmic breathing increases the efficiency of each breath, ensuring that the oxygen you do take in is fully utilized. This is a tool you always have with you. It requires no equipment. It works well for most older adults to center themselves during a crisis. Here is the final preparation step for the medical team. 8. Have your medical list ready. The 8th and final step is to have your vial of life or medical list ready. In a medical emergency, you may be too pain-stricken, groggy, or anxious to remember the names of all your medications, your allergies, or your doctor's name. Yet this information is critical for the emergency team. They need to know if you are on blood thinners, if you are allergic to latex, or if you have diabetes. Ideally, you should prepare this long before an emergency happens. Write down a list of your full name and date of birth, emergency contact numbers, a list of all current medications and dosages, any allergies to medicines, your past medical history, surgeries, conditions. Keep this list in a designated spot, like on the refrigerator or in your wallet. If you have done this, simply point to it or hand it to the paramedics when they walk in. If you have not done this and you are waiting for the ambulance, do not try to write it now. It is too stressful. Instead, simply gather all your pill bottles and put them in a clear plastic bag or a pile on the table next to you. The paramedics can look at the bottles and know exactly what you are taking. This simple handoff prevents dangerous drug interactions. It gives the doctors at the hospital a head start on treating you safely. It is a communication bridge that speaks for you when you might not be able to speak for yourself. This is about being organized. It turns chaos into order. It ensures that your care is accurate from the very first second. Facing chest tightness is undeniably scary, but having a plan replaces fear with action. By stopping immediately to sit down, you protect the heart from overwork. By calling 911 instantly, you secure professional help. By chewing aspirin, you fight the clot. By loosening clothing and unlocking the door, you remove barriers. By breathing calmly and having your medical info ready, you assist your own rescue. These 8 steps form a circle of protection around you in those critical first minutes. They are simple, actionable, and based on sound medical principles. You can do this. Memorize this sequence or print it out and keep it by your phone. Being prepared is the best way to stay calm and stay safe. If you know someone over 50 who needs to know this safety plan, share this video and subscribe for more simple health tips.